Was the particular procedure tunneled? Was it inserted, repaired, replaced, or removed? There's specific questions when you're breaking it down, and of course, before we go into the index, we're going to already have this information on hand because we know it's a question that's going to be asked or it's going to be in our one-liner. How was the catheter placed? How was it placed? AV fistulas are also found in this particular section, and of course, they are direct artery or vein attached. So we're gonna see some information on that. Grafting, again, you're gonna see some grafting taking place, perhaps some organ transplant. When we're talking about the cardiovascular system, that's where we see that bench work, the bench work, and so again, technical components, professional components, you may see that come up. Again, our different types of sponsors. What type of sponsor where we received this particular transplant. We're going to be seeing some of that come up again. And it's arranged ultimately the same way as in other bodily systems that we've seen. So we're beginning to kind of see some repetition in the arrangement of the CPT manual at this point. We have some different procedures that are introduced on the revascularization. And again, these are differentiated by site, the bodily site or location, whether it's iliac, tibial. We want to make sure we're in the right territory. So look at your documentation. Just like it's easy to kind of go from the system, bodily system that we're in to a totally different system, and you'll see that with the digestive system. In the digestive system, there's a lot of notes to go to the integumentary system for certain bodily parts. So, and when we were in the integumentary, you know, it's easy for a student to start coding out of the digestive system because there's so many overlapping in the types of procedures that are performed. I know it sounds funny, but there is. Okay, so again, make sure that you're taking a look at the particular regions for these cardiovascular procedures that are being performed. If it's a pacemaker, take a look at the number of chambers, take a number of, was it a lead? Is it battery operated? What's being done? What is being done for this particular procedure? When you get into the arterial and the venous procedures, which fortunately, we really don't do too much of that in our textbook and the workbook, okay? In this section, they're pretty straightforward with their coding. They're not going to throw you a curveball. They're not going to get as complex as someone who's been coding in the cardiovascular system for 5 years. So, not gonna throw you a curveball there, okay? Don't let this particular section overwhelm you. And if you do have a question about any of the questions as you're approaching them, definitely post it to the general questions, and I'll help you out, best I can in that particular code. But use those tools. Use that Appendix L too, because that one. We'll look at a couple examples, and you'll know what I'm trying to say. So, digestive system. The digestive system is set up so that it is all of the organs from the lips to the anus. It is every system in between. In to out. So every single system that is within that path is in this part of the surgery section. The EGD, you will not find that abbreviation. We've talked about a few abbreviations where you can't find them. We looked at an example of that. this is another procedure where you're not gonna find that broken down. So again, those tools, knowing, use the acronym dictionaries, use the tools. If you come across something at any time and you're not sure what it is, take a look at it. How many of you have done a search in the acronym dictionary and come up with 5 or 6 different definitions for one term or one acronym? I have too. So, make sure you're looking at a particular procedure, or that your acronym's pointing to a particular procedure before you proceed, because that can throw you for a little bit of a tailspin. So, again, it's like making sure you're in the right section, right? So there are, digestive system I find to be very straightforward. It covers a number of different types of procedures. Again, endoscopies are really common in this particular section. You're going to see a lot of that. In this particular section, we see colonoscopies, different types of treatments for kidney stones, hemorrhoids. We've got quite a few different, or urinary system, I'm sorry, is kidney stones, but hemorrhoids, all of the different types of procedures that are performed on a patient. You have to make sure that you're looking at the type of technique that is being performed. Of course, with any of this, right? We're going to make sure we know what technique they're using. And again, that's where that possibly viewing the video or understanding the procedure a little bit more may become beneficial. Hernia repair is in this particular section. When we're talking about the hernia repair, that's where you may see, we talked about mesh in this class before. We talked about mesh, the use of mesh. That's where you may see quite a bit of information, or the application of mesh is in a lot of hernia repairs. So that is something to, again, you're going to see age. Age is brought up a lot in this particular section. And of course, how was the procedure performed again? Want to do some coding? Or do you want to take a tour through the CPT manual? I have it flagged. We don't have to, because I don't want everybody falling asleep on me like you did the last time. What do you want to do? Want to take a tour? I mean, it's pretty much the same. You've got your broken down into your particular sections. I'm in the cardiovascular, the beginning of the cardiovascular. And I still haven't gotten my book since from AMA, believe it or not. Still haven't gotten it. Call them again. So,
Asking for the malfunction.
it's like, geez, the ICD-10 implementation delay prevent them from working, or what? Crazy. Another thing that I want to point out is sometimes we do see some edits, errors with edits, and in not only some of these manuals, but the publishers' copies of the textbooks as well. And the reason for that, I want everybody to understand that this book is published when?
Beginning of the year, January.
January 1st every year. And right now we're in June. We started this course in May. But if you think about it, all of these books had to be printed by the publisher right after January 1st for long years. So they're, nobody's perfect. So just keep that in mind. You're going to come across them, especially in any of the coding education books. You're going to come across them because it's just rapidly, if you think about it, October 1st is the date of implementation for ICD coding. Okay, September, the semester begins. So, just keep that in mind. And I know that you're all,
The implementation, it got put back to 2015 though.
it did get delayed, ICD, but they're still publishing ICD-9. ICD-9 still needs to be updated. So, yeah, which is, they're actually maintaining drafts of 10, and they have 9 that they're updating, so. ICD-10, you can get those resources right online for free. Who published ICD? Thank you. I give it away every time, but WHO, World Health Organization. The CM, ICD-CM, CM is the clinical modification, which is United States only. Does everyone know that? And it's actually 70,000 more codes than the International Classification of Diseases. It's a clinical modification just for the United States. Because the United States has to make everything complicated. Complicate me, CM. No, it's because of a lot of the different quality tracking and specific to this country, different things that they wanted to monitor, and perhaps the procedures performed a different way, or so it was.
Are we sicker here?
Not necessarily. I did actually, it's not that we're sicker. I have a pretty interesting site that maybe I'll have everybody take a look at, which has some statistical information, but it's based upon the coding aspects. So everybody can kind of get an idea and kind of play around with it a little bit, just to see, as far as quality, access, and cost of patient care and the population, how it affects the population. So it's kind of interesting as we move forward, like all of these different initiatives that are out there. Has anyone heard of Healthy People 2020? Has anyone heard of that one, Healthy People 2020? Look it up. Look it up. It's a lot of healthcare initiatives that are out there proposed by the Department of Health and Human Services for the year 2020. I know I'm getting a little off track. We're going to code in a minute, I promise. But let's think about something, okay? In 2011, our first baby boomers turned 65. Is everybody aware of that? Are you aware of the fact that 33% of our population is baby boomers? That's a pretty big percentage, isn't it? 33%. So they're all reaching the age of what? Of what?
65.
Exactly, and what are we eligible for at the age of 65? Medicare. So, boom. They call it the perfect storm in healthcare between the ICD-10 implementation, which affects cost, reimbursement, correct? Then we have, of course, access to healthcare. Everybody heard about the ceiling, right? The fiscal ceiling, and there was so much talk about it in the beginning of this year, and all of these different. We live in New Hampshire is a rural state, what they call a rural state, and a lot of the different services that were performed out there, that those sunrising acts, they were acts. They were different proposed rules that were put out there that allowed for money to come back to the healthcare organizations for laboratory services, radiological services, because a lot of rural hospitals can't afford to have these types of services provided in-house, or ambulance. So, you get a kind of a stipend or, an incentive from the government to be able to provide these services to the population because you're a rural area, and then they sundown. The healthcare organization still doesn't have the money to provide these services, so what happens? It becomes, access becomes an issue.
Yeah.
So, this is what they call a perfect storm, where you have all of these different factors coming into play. Of course, more and more people, with the way that the economy is being, or has been, I should say, people can't afford to eat anything more than processed foods, or, it's the whole kind of, they call it the triad of healthcare. So, of course, we have all of these different causes, and then we have effects, right? And the effect, of course, is on the population. So this Healthy People 2020 is an initiative that has been, developed by the Department of Health and Human Services. Check it out. it's some pretty interesting stuff, and it kind of gives you an idea of this whole, you know, spectrum of what to expect in the evolving changes. I know, David, you had mentioned about having the scribes. You know, there are so many things that they're trying to propose because there is going to be such a shortage of healthcare workers out there to provide care for patients. Everybody, you know, it's kind of Medicare keeps cutting. Is everyone familiar with what's been going on here in the state since 2009? With the, you know, back in 2009 to 2011, there were a number of layoffs at local hospitals. Did everyone hear about that? I mean, I think that there were like 174 from CMC that got laid off.
Wasn't that due to like that Medicare was
Medicaid.
cut, yeah, Medicaid had cut back on what their reimbursement was, and it really,
What had happened is
Really dent
actually
in people's funds.
the funds were misappropriated. So the funds were misappropriated and then recouped by Medicare. So the state had misappropriated, Medicare said, you need to pay us back, or Medicaid. I think it was Medicare. I think it might have been a combination of both, but usually Medicaid is a state level. But they wanted to recoup those funds. So because they've done that, 10 major hospitals here in New Hampshire have been paying that debt back. They recently, last that I had read in December, is now those hospitals are suing the state.
I think they didn't win the first round. I remember hearing they.
The hospitals didn't win the
Yeah.
first round? I haven't heard that yet, but that's not good if that's the case. But again, they're up against the state, so.
Actually, the Superior Court ruled in favor of the hospitals, not made two rulings.
They did rule in favor?
So we're negotiating with the governor to see what the next step is, how to
Good.
probably
Good.
spread out the tax and.
Was that just recently, or
I think,
maybe
a couple
April?
weeks ago,
A couple months ago?
a couple weeks ago.
Oh, okay, no wonder why I haven't
Yeah.
heard it yet. I'm like, huh?
So what
Good.
exactly happened? I mean, what happened if the hospitals were, what, taking too much money from the Medicare system? Is that?
Well, the hospitals received the money. It's not that, because it's doled out, you know, of course. I mean, if I get a check in the mail for $1,000, I mean, I'm really lowballing in here because I'm sure that the funds, you know, this is from the state, this is for these services that you provided to the patients, I'd be, okay, I wouldn't think anything of it. But then it was Medicare, when they conducted their audits, we overpaid the state of New Hampshire. It's almost like a big recovery audit, you know, and it's like we overpaid the state, and I'm sure this happens to numerous states. But that's that trickle effect. It cost so many people their jobs because those jobs had to be cut to recoup that loss.
So how do we guarantee we'll have it again?
There is no guarantee.
Like, I mean,
That's why we gotta remain flexible.
Like, we don't pay too much, you know, money towards our mortgage, you know, we're not,
Right.
you know, you're not, we don't, you know, I get that. You know,
Yeah.
Well, isn't it their fault because they were the ones, somebody used to check for too much money?
You would think, you would think. But
Isn't that
it's
why
kind of
the
a-
hospitals are suing? Because they haven't seen some, well,
Well, the
I'm from Vermont,
hospitals
so I
have
don't really know
had
what
to
they had
repay
so
it,
far,
and
but-
we're talking, I think it was $10 million. You know,
It
and the
seems to me like
hospitals
the
have had to
hospitals
repay
are
this
footing
money.
the bill for the state's mistake.
And what happened actually is, at the same time, double whammy for the hospitals is Medicare cut their reimbursement by another 25% across the federal, across the entire country. So on top of having to foot that bill, then they're losing another 25% for caring for Medicare patients. Where I'm going with this is now more and more healthcare organizations are saying what? I won't accept it. We won't accept it. So what does that say for that population of 33% that are
gonna build their own hospital, It's like
I didn't realize
government
they
care.
didn't actually say they won't accept it.
Yes, Medicare is totally, it's conditional participation. So you can choose, I mean, every healthcare organization has to provide so much free care, as they call it. But if they can deny a patient for their type of insurance. And more healthcare organizations are starting to do this for Medicare patients because,
Well, the financial director at Southern New Hampshire
article was saying that it cost them money